I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mealy. We're talking about a whole bunch of stuff. First off, we got breast augmentation, liposuction, mommy makeovers, and then finally, abdominoplasty. And I've been with you long enough, I can say all those. Woohoo. All right, before we get started, any advice we give you today, remember, consult your own physician. But let's jump right in.
Okay.
Hi there, by the way.
Doing?
Happy holidays to you, Dr. Mealy. All right, so let's talk about breast augmentation. Still very popular?
Still the most popular.
The most popular breast augmentation. All right, so when you go in for breast augmentation, how do you know you need augmentation or you might need a lift? How does one know?
You know, with the internet, a lot of people already know, but sometimes they don't know.
No.
Really, it's a matter of two processes. Augmentation deals with volume.
Yes.
So if breasts are smaller, then usually an implant's necessary to make it bigger.
Okay.
The lift has to do more with shape. So either sagging where the nipple, the skin is low on the breast, or there's just a funny shape. Sometimes we're born with breasts that aren't quite the shape that we want.
They're not the same on either side?
Yeah, and lifts allow us to help with symmetry and also allow us to help with the overall shape of the breast.
And sometimes you may need a lift, but you may not need the augmentation per se, right?
Yes,
okay,
and so if you wear a bra and everything's up where you want it to be, and the size is good, often the lift will take care of it.
Oh, that's nice. Maybe you don't have to wear that bra as much.
Yeah, well, yeah.
Do you have to change breast implants like we had to in the past? I mean, every 10 years, they're getting better, so we don't have to do that. What's the deal?
They're still not considered lifetime implants.
Gotcha.
You can't say it's going to last you forever. They do wear out, but it's about 1% per year. So implants can either get a hole in them or leak. With the saline implants, very honest implant, when it leaks, it goes flat.
Oh, okay,
Very
so you pretty much know.
Don't need any special tests. With the gel implants, the newer ones are very cohesive. So the center is almost like a solid.
Like they call them the gummy bears.
Yeah, so they don't migrate, which was a real problem in the past.
Yeah.
So that's a huge benefit. But because they kind of stick together, if you get a hole in the shell, you may not know.
You don't know.
Yeah. So
let's go to pictures. Everybody likes the picture part. So show and tell. There we go, first one.
So
wow, that is a beautiful
job. So here's
an
augmentation, not going up super large. The advantage of a breast implant is you can fill not only the bottom, but also a little bit on the top.
Right,
and you don't want most people don't want to overfill it, some do, and I know how to do that, but most of the time we like to keep it teardrop shape. In this case, the nipples were a little bit low, and I think they were a little towards the middle, too. So we brought them up and out and sort of made them
Did you have to cut around the nipple on that one?
So in this case, just around the nipple. So that's a periareolar lift.
Very nice.
So it's sort of the smallest scar, but it also does the least.
Wow, look at this picture. Second picture here.
Totally deflated.
Yeah, definitely.
So she has worked very hard, lost a lot of weight. And unfortunately, the breasts are mostly fat. So when we lose weight, sometimes we lose our breasts too.
But that is a beautiful job. Where are the scars?
So this is a T, inverted T. Or sometimes called an anchor lift. So there's a scar around the areola and down, and then along the bottom.
Gotcha.
And that really allows me to do the most shaping. So when we've got this really elongated shape, we want to sort of wrap it around the implant, want to lift everything up. I need a little bit more scar to do it.
And this
so here's someone you think, they don't need a lift, they don't have any sagging at all, except their nipple is all the way at the bottom of their breast.
Oh, wow.
Which is great if you're a guy, but not so great if you're a woman.
Oh, okay.
So if I just put an implant in, the nipple would be still at the bottom of the breast, right above the fold.
I gotcha.
So in this case, I did a vertical lift. You can kind of see the scar running up and down.
You can see the scar a little bit,
the black square. And there's a scar around the nipple because the areola has new neighbors.
And those scars fade. I mean, they look pretty good after.
They fade with time, and overall the aesthetics, I think, are worth it.
That is beautiful. And another picture here.
So here's someone with severe asymmetry. So she has Poland syndrome. So the left breast is smaller than the right, and the nipple is a little bit different position too. So I've done completely different operations. We were talking about doing breast augs with lifts. I did. I just did one on each side. So the left side, I did an augmentation, added an implant. On the right side, I did a lift to make it match. Could have done.
Oh, that's amazing. Okay, I see what you did. Okay.
Could have done more for symmetry, but she's a young woman. We're trying not to do anything more than we need to. The only hard part with this is the left side, where the implant is, will always have a little more fullness at the top than the right.
Yes, exactly.
So an implant would do a better job. But again, she's planning on having children.
Yes, so wait until after all that. We're going to talk about that a little later in the show.
Clothes and bras fit.
Last one.
So same idea here, just nipple a little bit low, moving everything up, adding some volume just to balance it out. So it's a lift with an implant.
With an implant in that one.
Yeah, all of these I use an implant.
All right, sounds great. We got a lot more to talk about. And recovery time on an aug?
Augmentation, a week or so.
Week or so, so not bad, right?
Yeah, usually the first couple days or so, and by the end of the week, people feel pretty good.
Beautiful, with your nice new breasts. All right, for more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, because all the pictures are going to be on the website, right?
Yeah.
Either drmealy.com or sanfranciscobreast.com. Lots more to talk about, so keep it right here on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.